Hello friends, now we are demonstrating the characteristic features and peculiarities of a very new design innovative anchor which is called as an OsteoFix FD anchor. Now as far as the metal anchors are concerned, this is our latest generation and this has got very much significant peculiarities which make this anchor a present choice anchor of my fixation as far as the medial row or a single row repair of the rotator cuff anchor. The anchor has got a very good pull-out strength, and if you see the difference from the earlier generation metal anchor which is seen here, this anchor only has a cancellous pitch or the cancellous threads, whereas this anchor has got dual pitch. So the lower anchors are cancellous threads and the upper threads are cortical threads. Apart from that, you have a vent inside. So the most important thing, the pulley where the thread rolls around the anchor in this particular anchor is on the tip of the anchor, and what it does, it does a very good purchase of the anchor, and the anchor takes a purchase both in the cortical and the cancellous part of the humeral head. So if you see this anchor, if you can just appreciate this anchor, most part of this anchor will be taken up by the eye. So the most important place where the fixation has to come, that fixation would be at the level of the eyelet. Can you see eyelet? So this is the eyelet, and this eyelet will be sitting on the cortical level, and this is the level where you have the best purchase of the bone. Okay, so that area is wasted in fixation, whereas if you see this particular anchor, you can realize that the anchor is totally fully with threads. So there is no part of the anchor or no eyelet which loses the point of fixation. So you have a fixation of the anchor right from its tips to the top of the anchor. Besides, there is a vent inside, and this vented area also gives possibility of bone ingrowth. So there is no bone ingrowth here, but there is a bone ingrowth here because of the vented design. The second important difference is, if you see this eyelet and this, the coupling mechanism is weak, whereas in this the coupling mechanism is stronger. So here the shaft of the screwdriver goes into the anchor, okay, whereas here the shaft goes around the anchor, outside the anchor. So this makes a more sturdy purchase, and there are less chances of a mismatch or a torque failure between the anchor and the shaft. Okay, so this anchor and this shaft, when you screw in, occasionally what happen in an anchor with the eyelet, when you screw the anchor in a tight bone, there can be a disengagement between the eyelet and the shaft, which will not happen here. Okay, so this is a fully threaded design, and this is a differential threaded design. So you have a cancellous pitch, you have a cortical pitch. The anchor itself in this new design is ergonomic, and the pull-out strength is very good. So if you use this anchor, you will hear the squeaking noise at the time of insertion, which signifies that the actual pull-out strength and the holding power of this anchor is very much better as compared to the earlier generation anchors with eyelet. So nowadays I prefer this as my initial fixation. And mind you, this fixation is more stronger, the pull-out strength is much better than some of the peak screws and some of the biocomposite screws anchors which are available in the market. So very good pull-out strength, very good biomechanics, very easy to insert, the design is ergonomic, the handle is new, and this handle is locked in here. So the wires are locked in here, and you will not have a disengagement or torque failure of the shaft versus the anchor. So these are the advantages of this OsteoFix FD anchor, and I would recommend this anchor as my first choice anchor for medial row and single row fixations for the rotator cuff repair. Very good pull-out strength, very good ergonomics. Any questions?
It is available in.
And the other thing, as I told you, the length is same. So here the length is wasted because of the eyelet, and here the length is same. If you can just realize, the actual length is same, but you get better area of purchase. You have a longer area where the anchor will hold. Here the anchor will hold only in the cancellous area, where in this part the anchor will hold in the cancellous area as well as the cortical area.
Differentiation is a good differentiation. Purchase
Is good. So, and plus the purchase is very good. So you have a cortical purchase, that is very important. So this phenomenon is actually similar to the peak screw. If you see any of the peak screw designs, they will have the same sort of a approach. But the problem is the technique to make this fully threaded and to weave this thread into the metal part is difficult. So that is why whenever you want to use a metal anchor, try to use this design of metal anchor as compared to this design of the metal anchor.